Those who work in health and care are keenly aware of the need to identify and manage risks to protect patients from harm. But we aren't the only industry that must take safety seriously. Is there anything to be learnt from comparing notes with other safety-conscious industries? To find out, we interviewed experts across all sorts of safety-orientated roles, those in health and care, but also those in oil and gas, shipping, aviation, rail, road, nuclear, and NASA, on a mission to understand their approaches to safety management. In these fields, systems for organising and coordinating safety are often called safety management systems, or SMSs. There's no one-size-fits-all SMS, but they share 5 core ingredients. First, identifying potential hazards. Secondly, managing known risks, assessing and prioritising them. Third, monitoring safety performance, questioning how real-life outcomes compare to expected levels. Fourth, handling change effectively, quickly catching unintended consequences. Fifth and finally, promoting safety, giving everyone the tools to manage safety and driving home the mindset that this is a shared responsibility. Across the board, interviewees stressed the importance of well-coordinated leadership to secure buy-in and weave an SMS into the organisation's fabric. A distinguishing attribute of SMSs is that they are proactive. It's about managing risk before harm occurs and assuring processes to be certain that they are safe. Responsibility should be clearly defined at an individual and organisational level, looking beyond one person, team or site in silos and considering the entire industry as a single system. So then, turning our thoughts back to the world of health and care, should we rethink how we work together, learning from the SMS approach? Health and care workers told us that although their processes have much in common with an SMS, ongoing safety risk persists because change is difficult. A change might be made to, say, introduce remote consultations and virtual wards, but then who is responsible for assuring the safety of these wards? Hundreds of interconnected organisations and over 1 million employees make up the NHS, with a complex landscape of stakeholders on top of that. Action taken in one area can have countless knock-on effects elsewhere. For example, discharging patients to social care may free up beds, but can they then access appropriate care, or are they put at further risk? There are clearly no quick fixes. We need to assess levels of safety maturity, understand the accountability framework the health and care system needs, and promote the principles of safety management. The safety management system approach could help the health and care sector better manage risks before harm occurs, delivering safer levels of care. For further information about this work, visit the HSSIB website.